gone through my experiences with different cups, let me put together what I think are some of the qualities of a cup that you really want to look for. And again, I haven't found the perfect cup, but maybe you will find the perfect cup. So here are some of the American Dental Association recommendations for sippy cups. Number 1, sipping is not sucking. You need to have a cup that allows sipping. So if you can find a cup that allows sipping, cups that will do well are ones that tend to be without no spill valves. So you want a cup that will unfortunately allow some leaks. But in the process of allowing leaks, it allows your child to drink from the cup without having to use a vacuum cleaner to remove liquids from the cup. Some of these cups will be noted to have a snap-on or a screw-on cap, and they will have a spout, either a hard spout or a straw. The problem that most dentists and doctors have with these more flexible spouts is that they're essentially no different from your typical baby bottle. They still require you to bite, suck, and swallow, and that is not a natural adult mechanism of drinking, so it's not to be encouraged in your toddler. So recommendation number 2, avoid any sugary beverages. Please, please, please try not to give your children juice. As we say, fruits are for eating, not for drinking. All right? And try to avoid sugary milk. Whole milk or 2% milk is preferable, and water. If you're going to give juice, try to dilute it, and if you're going to give juice, only give it during meals. Why no milk or juice or bottle at night? Because you'll be encouraging tooth decay, and bacteria love sugar. The nice thing about meals in this process is that the saliva that your body produces during the meals will help to neutralize the acids that are created in juices, and acids also contribute to dental erosion. The third big thing with sippy cups is to use sippy cups with supervision. You don't want to run with cups. There's a study that recently came out in Pediatrics, the Journal of the American Academy of Pediatrics, which showed that there were a significant number of emergency room visits, lacerations, falls, head injuries, just from children having sippy cups and running around, either having them in their mouth, falling while they were in their mouth. And so I really encourage you to use common sense. Safety is important for all of our children, so you don't let them run with scissors, you don't let them run with lollipops in their mouth, so don't let them run with their sippy cups in their mouth. Have them sit and drink from their cups. Please stop using a sippy cup as soon as possible. My son has been able to sip from a cup all the way from 7 months old. And the only difficult thing about it is that it requires constant supervision. I have to hold the cup in front of him, and he has to drink from it. And to tell the truth, out of all of these cups that I have described to you, his favorite thing is to take water from a spoon, to take water directly from a glass and sip it, or to drink from a regular glass and a straw. So if you do have to use a sippy cup, please try to discontinue it between 2 and 3 years of age. And when possible, encourage the use of a regular cup. There are a couple of cups that I'm interested in, specifically the OXO training cup, the reflow cup, and the tippy cup, which are all regular cups that allow a limited flow of liquid. While they are not leak-proof or spill-proof, it is my hope that they will limit the number of spills that children have with these cups, just because they limit the amount of liquid that comes out. Thank you very much now for watching my blog. I really appreciate it, and I'd love to hear any feedback that you have to offer, or I'd love to hear about any topics that you would like me to vlog about or blog about. So thank you, and have a good night.